Hello guys, welcome back to Live Talks with MercyPaul. Thank you so much for always watching my videos, for following me. I really do appreciate, and if you're watching this video, I appreciate you too. Today I want to talk about the hormonal contraceptives. I did a video on all the non-hormonal contraceptives where I included the hormonal IUD. So yeah, I'm going to talk about all the other hormonal contraceptives. So we have so many hormonal contraceptives, but I'm just going to lay emphasis on those methods that are commonly used, very effective, and readily available. Because there are other methods like like the patch and others that sometimes their effectiveness is very low. So I don't want to give misleading information. I want to lay emphasis on those methods that are really useful and helpful, and they are the most commonly used methods. So our first hormonal contraceptive method is the emergency pill. The emergency pill simply works by delaying your ovulation, and it also prevents ovulation altogether. So when you take an emergency pill, if you've not reached your ovulation days, it's going to delay the ovulation or stop ovulation altogether. So that's how it works. But as I said in my previous video, the copper IUD has been found to be more effective in terms of emergencies compared to the emergency pill. So you might want to consider. One thing for sure, if you use the copper IUD, it can be left in place. So it's also going to serve as a long-term contraceptive method. And for the emergency pill, you have to be very cautious when you're using this method, because you're supposed to take at maximum 2 times in a year. So don't use the emergency pill as a normal form of contraception. It's supposed to be taken only in terms of emergencies, and this includes like rape cases where maybe you've been violated, or sometimes you're using, for instance, a condom and you experience a condom burst, then you can use the emergency pill. Another very good hormonal contraceptive is the combined oral contraceptive pill, and we have the progesterone only pill. The combined has progesterone and estrogen. It simply works by preventing ovulation, so there will be no egg fertilized. It also thickens the mucus on the cervix, thus making it very difficult for the sperms to swim towards the uterus, and it also thins the lining of the uterus, so there'll be no implantation. When you're taking the COCs, it has some good advantages because your periods become lighter. They also become very regular, and if you experience severe cramps, of course the cramps go away or reduces. It's a very good form of contraception. Very good thing about the COCs, they prevent colorectal cancer, uterine cancer, and ovarian cancer, and they have also been found to work very well with acne. So if you have problem with acne and all that, you can use COCs, and it's going to make your skin all soft and smooth. The return to fertility, it is usually almost immediate. They rarely cause hormonal imbalance, so when you stop taking the pills, you can conceive as soon as possible. And by the way, pills do not cause weight gain. Any form of contraception that contains estrogen and progesterone does not cause weight gain. Another con of this method is that you have to take the pill the same time every day. The same time every day, even if you're not sexually active, you must take the pill. So if once you begin the cycle, you must finish the cycle all the way to the end, because if again you stop in between, you might experience some bleeding. For instance, if you're taking the combined oral contraceptive pills and you experience vomiting immediately or 30 minutes after taking the pill, of course it's not going to be very effective. So if in such a case, you take another pill. So if you're also taking the pill and you forget, like for instance, I was to take the pill last night and I forgot. So the moment I remember today, anytime I should take the pill that I was supposed to take yesterday. And if I remember when I'm due for another pill, then I should take the days and 2 days. Another con of this method, if you have a problem with DVT, deep vein thrombosis, it also increases the chances of getting deep vein thrombosis. So if you have a history of DVT, you should not take combined oral contraceptive pills. The combined oral contraceptives, you have two types of pills, the monophasic pills and the phasic pills. The monophasic pills contains the same level of hormone from the first tablet to the last tablet, but the phasic pills contain different hormones. When you're taking the pills, normally they have numbers behind the sachet, so follow the numbers from the first to the last. For instance, there's this the commonly known brand of Femiplan. Femiplan, the first 21 tablets contains estrogen progesterone hormone, but the last 7 tablets contain iron, which is really good when it comes to HB and all that. For instance, you're taking the Femiplan pill, and you start like from number, is it 30? From number 28 to number 1, my friend, you're going to conceive. And that's a common mistake that people make, because they say, I conceived and I was using the pills, but you were using the pills the wrong way. Once you take the pills, usually there's a 7-day break. That 7-day break is optional. If you don't want to experience your menstrual period, then you can take the pill from the first to the last, and then once you finish the last, then you start another sachet immediately without the 7-day break. Of course, you're not going to experience your periods. I know some of us, these things can be very hectic. A very common hormonal form of contraception is the Jadel or the implants. The implants or the Jadel, they are rolls like this. You see, they are elastic. So these are just it. They look like this. Yeah. So these rolls I'll put under your skin on the left arm, right, which is my left. This one right here, they are put right here. I don't have any so usually they are put somewhere here under your skin. And we have the one that goes for 3 years, and we have another going for 5 years. For instance, this is for 5 years. It's not painful because they are put under local anesthesia, and also when it comes to removing, they are also removed under local anesthesia. They contain progesterone only hormone. They simply work by preventing ovulation. They weaken the cervical mucus, also thin the lining of the uterus. So this method, just like any other hormonal contraceptive, you're not supposed to use if you are hypertensive or you have any other hormonal related illness. This method is 99% effective. That's a very good rate. And when you have this, you don't have to worry about popping pills every day and all other things. Yeah, and make your periods sometimes heavy, irregular, and sometimes you can spot in between periods. If, for instance, you experience heavy bleeding, because sometimes it can go for even a whole month, you can bleed for even a whole month. But if you experience bleeding and it goes for more than 7 days, which is the normal time, then you should go to your healthcare provider, because it causes some hormonal imbalance. Since it has only one hormone and the body requires estrogen progesterone, so sometimes it suppresses estrogen, you experience those symptoms. Your periods may also disappear, like you can go for even a whole year without having your periods. I mean, this will be a very good thing, Another common form of hormonal contraception is the progesterone-only pills. They also work by preventing ovulation, thickening the cervical mucus, and thinning the lining of the uterus. These pills are very safe for women who are breastfeeding. Any hormonal contraception that does not contain estrogen, it is very safe for a woman who is breastfeeding, like the implant and the pills and the depot. Those methods are safe for a woman who is breastfeeding. The progesterone-only pill, you have to take it the same time every day, just like the combined oral contraceptive pill, even if you're not sexually active. With the progesterone-only pill, there's no 7-day break. The sachet usually contain 35 tablets. So when you start from the first, and as I said, always follow the numbers behind the sachet. So use the sachet from the first to the last. Immediately you finish that cycle, then begin another cycle, like that, until the baby is 6 months. Then you can switch methods. Another method that is very, very popular is the depot. The depot is a progesterone-only form of contraception. It's an injection that goes for 3 months. So you get a jab after every 3 months. This method works like all other hormonal contraception method. It has been found to be very effective, and it looks like this. It looks like this. Yes, it looks like this. Yeah, this is how it looks like. And while you're using this method, your periods may become heavier, irregular, sometimes lighter, sometimes heavier. Sometimes they can they can go away altogether for some time. The women, while they're using this method, they do not experience their menstrual period, and I think that's the reason why most women love it, because they are using it, they do not experience their menstrual period. But it is not the same for everyone. There are some, when they use this form of contraception, they experience heavy bleeding. And as I said, anytime you experience something that you feel it is unusual, just go to your healthcare provider, because sometimes it also causes hormonal imbalance, so you experience your periods longer than you should. So when that happens, normally you're given some tablets that helps in hormonal balancing, and that goes away. The return to fertility is usually 3 to 6 months. With this method, you cannot use, just like any hormonal contraception method, if you are hypertensive, it is not advisable you use the depot. Or also, it brings about some weight gain. All the progesterone only forms of contraception, they bring about weight gain, but not to all. There are also some women who experience weight loss. That's it for the hormonal forms of contraception, guys. Thank you so much, guys, for watching. I'll see you in my next video, that is on Monday. Thank you so much, guys.